Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have any questions or concerns or seeking advice, diagnosis, and or treatment, please seek individual, personalized advice from a healthcare provider in your area. We are not liable for any risks or issues associated with using or acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride. Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant.
You'll notice I dropped the license or the clinical because I was
You're
like,
confusing yourself.
Same. But like I kept going back and forth and I'm like, it's all the same. It doesn't matter. So I'm shortening my
clinical, plain old just psychologist.
Yeah.
Dr. Nicole Peniston.
Please. Yes, I'm no one's. If you're listening, it's highly unlikely that I'm your doctor, but you never know. Maybe I am. So welcome.
So what's interesting, VAs have actually made an official change to physician associate as far as recommendation, but none of our state boards have changed it yet. And our national certifying organization, I don't think has changed it yet. So until it says it on a piece of paper, I'm going to say physician assistant, but we will be physician associates at some point. They tried to keep it as PA so people remember it, and they tried to just be more in line with what we do nowadays from when the profession started. So
yeah, because you're not really assisting anymore. You're more independent.
Right. So anyway, eventually I'll start getting used to it, but 20 years in, my brain is still, you keep saying it the other way.
Well, fun fact, in New Jersey, even though my title is clinical psychologist and I'm licensed by the state, it is the State Board of Psychological Examiners, which is a fun title.
I fall under the Board of Consumer Affairs,
yes, which they oversee all licenses.
And then, well, for certain things, like a nursing board is completely separate. And then there's a physician assistant something or other. I don't know.
Yeah, lots of stuff. Lots of fun things that we all have to learn at some point. And I have to get all my CEs because I have to renew this year. So
yeah, fun stuff. I know I have to go to a conference eventually. It's been so long since I've gone to an in-person. Like I do everything online, but it would be fun to go.
Well, come to the one that I'm presenting at next month.
It won't count for credits for me. I mean, we go for fun. All right, so we're doing a double today. Double recording, double alcohol.
Yay. It's a Sunday.
All I've had today is coffee and Diet Coke, and then alcohol.
Well, I went to the diner with my mom and we had French toast sticks. So I had
nice. Well, no, I mean liquid wise, that's all I've had. I did scarf down, which I never eat fast food, but we were on the way back from a gymnastics meet that started at 8 a.m., finished around 11 something. So we were like, all right, what can we get quickly for lunch? So Mickey D's it was. So no, I scarfed down a chicken sandwich. So we're good.
I was going to say chicken nuggies. Those are my favorite.
I'm a chicken tender, like real meat person.
They have tenders now.
I didn't see it on the menu. I don't know. Maybe I was very flustered trying to get it done at the drive-thru. I'm not a drive-thru person in most days. So
well.
Anyway, anything else
off topic, but I went to the drive-thru the other day because it was late and I was tired and I still had work to do. And someone's car broke down right at the window where you pay. No. And I was like, that's everyone's worst nightmare, that your car just dies right there.
And the business too,
And then she had to wait for she was on the phone, and then the people at the McDonald's were on the phone trying to get a tow truck. It was just a hot mess.
Yeah, I guess they have to direct everybody inside.
Yeah, we all had to go around, and it was a pain in the butt. And I honestly, at first I was annoyed, and then I felt bad for her because I'm like, every car that drives by, they are staring her down.
Right, and you were flustered and stressed out.
Yeah.
No,
I probably would have just started crying.
Oh my goodness. So if anyone, when we post the videos, sees Nicole is in a different location, she's at her mama's house.
I am. She has her beautiful display of decorative ceramic shoes behind me in a tiny little house that I bought her forever ago. She's had that for 30 years.
My goodness.
Yeah. I am in her home office, which is much nicer than my home office. So I'm a little jealous.
Yeah, I need to clean stuff out of this room. This is like the throw all room. Just anything that we don't want anything to go anywhere, just throw it in this room and close the door.
Yes, same with my home office, but it's a work in progress. It'll get there. So today, I believe I start as you
Mm-hmm.
told me 15 times before we started. And then I was like, wait, I start? So today my drink is kind of giving it all away, but that's okay. My drink is called the Munchausen.
Nice.
And it is 1.5 ounces of watermelon schnapps, 1 ounce of lemon vodka, 2 ounces of pineapple juice, 2 ounces of mandarin juice, which was super hard to find. So I hacked my life and I bought the little mandarin juice fruit cups and poured the 100% juice out of that.
So
I don't know
smart.
if it's actual mandarin juice, but it's in my drink.
That's why we keep you. You're smart. You could have bought little mandarins and
That's
squeezed
true.
those.
I wasn't doing all that. 1 teaspoon of grenadine syrup and 2 ounces of lemonade. So you shake all but the lemonade and then strain it into a Collins glass half filled with broken ice. I don't know why broken versus other ice.
Crushed ice.
No, it says broken ice.
Broken.
And then add lemonade and serve with a straw. I'm trying to save the turtles, so no straws. But I did add a beautiful little, you can't really see it, but a dehydrated orange. Garnet. And
it seems very like tropically summery.
It does taste very summery. Yeah.
Nice.
So, and then I did make Deb a drink. So if she's listening, hopefully she enjoyed her drink. She didn't have quite as much watermelon schnapps left, so hers isn't quite as bright as mine is, but they taste about the same. So because the name of my drink is the Munchausen, what do you think I may be talking about?
Munchausen syndrome or Munchausen by proxy, which they don't call them that either anymore.
No, they actually call, and I was going to talk about that, but the formal term now, the diagnostic term is factitious disorder. So we'll get into that. But I watched, well, in the grand scheme of things, there are multiple stories that have been out there in the news, documentaries, real life movies based on real life with some dramatization about Munchausen. So one of the most popular ones in the last few years was talking about Gypsy Rose.
Yes.
And how her mother had committed Munchausen by proxy upon her by making her and many of her medical providers believe that she had cancer and all of these other types of illnesses. And then more recently, more stories have come out, one that you're going to go into a little bit later, so I'll hold that off to the end. But I am talking about Scamanda. So Scamanda is not a person. It was the name originally of a podcast, which they then made into a TV show based on the podcast. That's like a new trend apparently, because I've seen like Sweet Bobby, which I feel like I have to say it in the accent, Sweet Bobby. I just love the British accent. But there's been several things lately that were originally podcasts and were super popular, and then they made them into TV shows or dramatizations. And so I think that's kind of cool, because then people who aren't listening to podcasts are still getting to take in that information, because they are pretty compelling stories. So Scamanda follows the story of a woman who essentially, long story short, is faking cancer. So her name is Amanda C. Riley, and she was a mom and a wife, and she was part of the San Jose church community in California. And essentially, she had told her church community that she had brain cancer and stage 3 cancer and was dying. But this continued to last for several years, which this may sound familiar to people who are familiar with Scamanda or have seen the show or know some other stories we're going to talk about. But this was literally years, almost, I believe they go back and they say it was over 10 years of her claiming that she had stage 4 terminal cancer. So it's if your cancer is that severe, unfortunately, you're not going to survive for 10 years.
Right. They actually grade that in usually 5-year survival rates. Right.
And so that was when I'm watching this. And of course, retrospect or hindsight is 2020, but looking at that and if someone tells me in say 93 that they have stage 4 cancer and now it's 2024, I'm going to be like, wait a tick. And I probably would have thought that much sooner, especially because it wasn't like it was a one-time conversation that never brought up. This was consistently brought up in her personal life, on her social media. She had a whole blog about it. She also had joined a church, and the church was frequently, it seems like almost on a monthly basis, if not more frequently, giving her money for her cancer treatments. Wow. So this was a very long-going scam, and it was very clearly both for attention, but also for money, because it seems like the financial gain began pretty soon after the topic first came up. Whereas in other situations, financial gain may come later or not at all. And so that's the interesting thing about factitious disorder, or Munchausen, as many people know it, is it can be for personal gain, but it's not always financial gain. And we'll get into that in a little bit. But basically what happened with Scamanda was people started looking into her case and finding out she wasn't even visiting these hospitals or had any appointments there. And so that was kind of a question that lingered for me as I was listening to the podcast, but then also watching the documentary. Is she had all these photographs from like emergency rooms with like herself with like an IV. And I can see if you have an ER visit once and take a bunch of pictures and then post them throughout time. But this clearly seemed like over years she was having medical treatment at hospitals. But I can't imagine that you would be in the ER multiple times for no reason and someone in that hospital wouldn't catch on that something's going on.
Yeah.
Especially at this point in time where we know more about medical fraud and things like that. It was a little confusing. Maybe she was doctor shopping. Maybe she was hospital shopping and going to several different places. It's highly possible.
Right, because everything doesn't talk to each other. A lot of patients, it's
Exactly.
funny. Back when we had paper charts, I think they understood that. But now they think electronically that everything's connected. I'm like, yeah, no. So if you went to this hospital system and then you went to that hospital system, they don't have that. I don't have that. I'm in a private practice. You know?
Well, and I think too, what's a little bit more difficult now is that some patients aren't as savvy to know which systems are connected and which aren't, because some are connected, or like it may be called, this general hospital, but it's connected to this larger system. So you do have to do your research to find out who is speaking to who.
But people who want a doctor shop,
they will
are savvy.
Exactly. They are catching on to that, which it's not rocket science. This is all public information that you're able to find for yourself because you're able to look into your own medical records. So if you want to know who has access to that or who's finding what information, you do have access to that. It's just most people are just like, I'm sick, I got to go to the doctor. They're not looking into this further. So essentially what happened after some time was Amanda was taken to court for financial fraud and for medical fraud. And they knew that basically they're saying that she has this whole website where she's saying, send me donations, send me money. Thank you for this donation. Thank you for this money for my cancer treatment. And that was really her undoing because they had documented evidence that she was doing this, knowing she did not have cancer and taking people's money. And so essentially she did end up pleading guilty in federal court and admitted to scheming more than $100,000 in donations. She was sentenced to 5 years in prison and ordered to pay restitution. A part of the documentary that they don't fully go into is during this time, she has a husband, somebody that she had married, I believe after her first mention of cancer. She has children, she has stepchildren. So these other people are getting affected by it and they don't really go fully too much into it. They talk more about the people who were donating money or who were her friends or the church members and how they were feeling about this. So that's basically Scamanda in a nutshell. Like I said,
so was she fooling the medical providers? Because usually Munchausen, they make themselves sick so that treatments get done or something, right?
And so that's kind of the gray area because she was definitely in the hospital multiple times, but she's posting on social media that she's in the hospital for cancer treatment or that she's, going here for this, but we don't really hear too much on the hospital side of things. And that might be part of it, might be things like HIPAA, like preventing release of her medical information. They did say that a lot of the health issues that she did actually have were much lower stakes. So asthma, low blood pressure, irregular heartbeat, things like that. So at least enough to get you into an ER visit. But they said that there were some healthcare workers that reported that they saw her holding her breath during an oxygen saturation test.
Right. There you go.
That they saw her playing with infusion pumps.
There you go. So that's where you're trying to trick the providers because that's what sets it apart from just frank lying. There's two different things, right?
Yeah. And with this, I think where they really were able to get her was on this identification through her own website of these individuals who were giving her money and how much they were giving her. She would say, shout out to Miss Smith for sending me $500 this week. She was being extremely explicit about it. But then they also said that when she was in prison, during her first 18 months in prison, she had 24 emergency room visits. So clearly she has learned to fake this convincingly enough that the prison officials were also making sure she was getting medical treatment. Now, that gets a little bit more complicated because there are liability concerns. And if you are ill and in prison, yes, they have to take her to prevent any issues, while she is in their custody. But still, if she, in 18 months, she's going to the emergency room 24 times from a hospital, which that is not easy to do because they have medical staff, nurses and things like that in the prison.
But I bet they're not 24 hours and she's savvy to when there's no one there. And then she tells a problem and then the guard's like, I'm not getting in trouble for not sending her to the hospital.
Of course.
These people are savvy. They're smart. They're not dumb.
And then what was pretty interesting was her attorneys said that because she's so ill in prison that they should reduce her sentence. And it's wait a minute. She's in there because of this.
Is there a medical professional saying that? Because if not.
Exactly. exactly. And then there's a lot of details that I'm not going into. It's a quite long and in-depth story, but that's the general concept, is that she was purposely faking her illness for financial gain, for emotional support, for attention. And she was, brought to court for that and did have to serve a sentence. And they did find that despite what her attorneys had filed, they found that her medical issues were not enough for her to have a reduced sentence. So they were not saying, oh no, she's not sick. They're just saying it's not sick enough for her to be released early from prison.
There are people who are getting chemo for cancer in prison.
I was just going to say that in certain states, there are specialized prisons for prisoners who have severe health issues. So at most, they would transfer her to a facility like that versus let her leave. And so that's a whole different, really fascinating thing we could talk about, is those specialized medical prisons, but that's for another episode. But during her trial, they did say that she exhibited symptoms of Munchausen syndrome, which this trial was back in 2021. So they're not necessarily using the correct medical terminology as factitious disorder. I believe it was changed in 2015, but still, everybody knows what Munchausen is. So maybe they were doing that more for the benefit of the jury or the judge or something like that. So, and she was 39 years old at the time of this. So if she was faking this for some time, this started early on, like when she was in her 20s. So, and that's something that we can talk about in a couple minutes, about when this stuff starts, how it starts, why it starts. But Scamanda is just one example of someone who has Munchausen syndrome or factitious disorder and was doing it for financial gain. And then, as we know with the case of Gypsy Rose, her mother definitely was benefiting financially off of it, but it definitely seemed, by everything that we've learned from it, there was definitely a big part of it that she was getting that emotional support that she never had before.
Right. When the parent is doing it, sometimes it's a weird emotional thing, the attention to it, right? Getting more attention to me, to my child, not just financial.
Yeah. And I mean, for her, when we looked back in some of the history, so Gypsy Rose's mother was Dee Dee Blanchard, who ultimately Gypsy had murdered. That's a whole different part of the story. But Dee Dee was making Gypsy sick. They did have documentation on that. They were able to eventually find that was the case. Unfortunately, it was really not truly proven until after Dee Dee's murder. But there was definitely concerns that something was being done to Gypsy at many points in her life. And it was pretty significant. It was pretty severe. For anyone who's watched The Act, which is the dramatic reenactment of that story, a lot of those things were factual of what happened. She was given chemotherapy. She had her head shaved. She had a feeding tube and was eating primarily through the feeding tube for the majority of her life. She had all of her teeth removed. So she did go through quite a bit of trauma, essentially, from all of the stuff that her mother was doing. But they also did have financial gain. They had a house built for them. They had donations. They had a lot of financial gain from it. But clearly there was more than that going on for it to go on for so long and to such a severe extent. One of the things that comes up a little bit in The Act and in some of the documentaries is that Gypsy's father wasn't in the picture. And so at first they were like, oh, well, Dee Dee is struggling as a single mom. But then we come to find out later on that her father had been paying child support throughout the years, and Dee Dee was pocketing the money for herself. She was not passing any of that on to Gypsy, told Gypsy that her father wasn't involved, that he didn't care. And then once all of this came to light, he did step forward, and he and his new wife, Gypsy's stepmother, essentially, were saying that they had done their best to stay in contact with the family and were just really struggling. So factitious disorder. Factitious disorder, formerly called Munchausen syndrome, it's a serious mental health condition where people deceive others by pretending to be sick. Munchausen by proxy, or factitious disorder by proxy, is when they're making someone else sick, typically a child, but sometimes an older adult, someone that they're in a caretaking position of. They're making other people sick in order for some sort of gain, whether it's financial or attention. It can range in symptoms from very mild to severe. So mild may just be like once a child is diagnosed with something that can be transient or may improve over time, continuing to get them treatment for that over a long period of time. Or it can be very severe, where now they're undergoing surgeries or severe medical tests that are unnecessary and very invasive. And factitious disorder is not the same thing as what we used to call hypochondria or things like that. That is when you as a person feel that you
believe
and you truly believe that you have an illness. You're not pretending to have an illness for something else. And so there is a distinct difference in that. Despite all of this, factitious disorder is relatively rare. I will say we're saying that now because we don't have the numbers on it. A lot of these people don't get caught, we don't catch onto it until much later in life or at all. And so there's probably a lot of cases that have not been diagnosed or have not been identified because these people have become very savvy with it. I think especially with the advent of the internet and being able to look up symptoms and look up stuff, you have more information at your fingertips. It's not like you have to go to the library anymore and take out a medical journal and read up on these symptoms. You can do it in the comfort of your own home or in your car on your cell phone.
Right.
So I think that probably makes it a little bit easier for some of this stuff to slip by, unfortunately. And I think that the other part of it too is a lot of doctors are really hesitant to call someone out on that because think of the ramifications if it's not true. If you're now accusing this parent of making this child sick and you're wrong. And there's another case I'm not going to go into today. It's a documentary on Netflix where essentially a mother is accused of making her child sick. The state takes the child away from her, keeps her in the hospital. The mother becomes so distraught. Essentially, she commits suicide. And then we find out after her death that this child legitimately was sick, which is a very rare disorder and should not have been separated from her mother or her parents. And so things can go wrong when you start throwing around these accusations, unless you have a lot of evidence. And so I think part of it is also difficult because if you think about it, if you go to a healthcare professional for the first time, every medical history we get, it's what you're telling us.
Oh,
so
yeah.
If you're telling us something fake, we have no way of knowing. And like I said before, a lot of these people are doing doctor shopping. So they're hopping from one practice to another. So they don't have an established history. So there are no question marks or red flags. There's also a lot of symptoms that people tend to fake because they're easy to fake. So pain is a big one. Pain is so individualized and so subjective that it can be very difficult for someone else to tell you, no, you're not in pain, or yes, you are in pain. And so pain is a big one. Other things like seizures, despite them sounding kind of confusing, people can fake seizures with relative appropriateness. I've personally witnessed fake seizures and I saw right through them right away. But in this case, I already was going in with like a little bit of questioning, not necessarily that they didn't have seizures, but the way that they were describing their seizures, like that's unusual. I wonder what that really looks like. And I was just assuming that the patient was just misreporting. I didn't think they were actually faking until I actually witnessed one.
So what's interesting with that is when I used to do medical consults at the inpatient psych unit, I remember there were a couple of children or teens on the child unit who had pseudo seizures, we'll say, as a diagnosis. And
which isn't always necessarily faking of seizures.
Right. Well, right. So the big thing that I think one of the neurologists had said was there's a certain time period after the seizure, and I believe it's a prolactin level to check.
Yes.
Because prolactin's your pituitary in your brain. So if there was whatever misfiring, that might, I believe it was prolactin. I have to look that up and make sure I'm not quoting wrong, but it's something to check. And if you caught in that right period of time and could check it, you could kind of confirm or deny whether, that was a real seizure or a pseudo seizure, which would, like you said, doesn't have to be faking it because that goes into
it could be just another neurological symptom that is looking like a seizure on the outside, but what actually is happening neurologically is a little bit different. So I think that's another reason why doctors don't want to necessarily accuse people of faking, because there's a lot of things that can happen that can look unusual or look rare. And just because you've never seen it before doesn't mean that it's not real. And then also, if you've met this person before and there's been no other red flags, it wouldn't even cross your mind that they are faking this stuff. I think another big thing that happens in these factitious disorder cases is tampering with medical tests, medical equipment, things like that. And so that is usually a way that they're caught, especially if it's someone who's been in an inpatient setting and maybe they're getting caught on camera, bringing things into the room or leaving the room if it's someone else, or taking something out of their pockets if it's for themselves that they're tampering with their own materials. Also, there's a lot of medications that you can take if you're able to get your hands on to mimic other diseases. So taking insulin, if you don't have diabetes, that's going to throw off your blood sugar levels, and that's going to be concerning. Taking certain blood thinners, that's going to make you now bleed more easily, and that's going to be of a medical concern to people. Sometimes reopening wounds, so that way they're not getting healed, or purposely letting them get infected, so now you're having problems. But then it can be as severe as injecting yourself with gasoline, milk, bacteria, feces. There was a specific case, I don't remember which one it was because I watched a lot, of documentaries about this, where a woman worked in a lab. That was her job. And she was taking home things that she knew were negative, like harmful bacteria, and putting them in her child's formula. So like that was purposeful. She literally had to smuggle it out of somewhere to bring it home to give it to her child. And they actually caught her on camera doing that. So that was how they were able to follow through. And then there's a lot of things where people might just give a false medical history. So then it's going to make providers think in a certain way about what these symptoms that you're presenting with may go. So if you're saying someone in my family had this cancer and now I've got like this really bad pain in my side and nobody knows what it is, the doctor's going to be thinking, okay, well, let's look for cancer.
Right.
And they didn't necessarily fake their own symptoms. Maybe they are having pain in their side. Maybe they're, like I said, in that more of hypochondria area where you legitimately have pain, but now you're jumping to the conclusion of cancer and then you're sharing that with your provider. So now they're looking for that. So there's lots of other stuff, but those are just kind of the top of the iceberg, the tip of the iceberg. Some risk factors for people who develop factitious disorder is childhood trauma, having been a victim of factitious disorder by proxy yourself. Or grown up in a family member where someone else was either had factitious disorder by proxy or their parents had factitious disorder of their own, having serious illnesses at any point in your childhood, either in yourself or in your family, just seeing the attention that people get from a serious illness, the loss of a loved one due to a death or a serious illness or feeling abandoned, past experiences with getting enhanced attention when you're sick. So sometimes that happens in households where maybe parents are a little bit more emotionally absent, but then when the child is sick, they're far more invested. And so now this child learns that if I want my parent to love me, then I need to be sick. Where that might not actually be the case on the parent side. They may just have multiple children or have high stress jobs or have their own mental health issues. But this child is now learning that this is how I get attention from
That's
people.
how they're perceiving it, right?
Exactly.
I absolutely could see that happening.
Yeah, definitely. And then especially like I was saying before, if you're in a household where you have a sibling who is very, very sick, that sibling's getting a lot of attention for a good reason. But then if you're not taking that in a healthy way or a healthy manner or be able to adjust to that, it could be very easy for you to want to take on an illness as well. Personality disorders occur a lot as a risk factor of someone who has a factitious disorder, which personality disorders...
Borderline, usually?
Sometimes it kind of varies. Narcissistic personality disorder can come up with that. And personality disorders have changed a lot with the most recent iteration of the DSM. So we'll have a full episode on that because it's not something that we're necessarily jumping to diagnose anymore for many, many reasons, but it is still a thing out there. And I think it's more important for the social aspect of understanding if someone has a personality disorder, why relationships are so difficult.
Yeah, I just remember again when we were doing medical consults at the inpatient psych, this is with adults, and you would sometimes see in teens who were kind of bordering on that, almost out of the teen area.
And it can start that young.
We would say that they're very somatic. This patient's very somatic, meaning they always have a physical complaint, and it tended to be for attention, usually a female, and usually you're thinking possibly borderline personality disorder, maybe also bipolar sometimes. But definitely felt more personality disorder. It was a very specific type of patient that you would kind of get this hint, and then you'd kind of know, but you have to address each complaint because you don't know, right? So you can't be like, no, you're lying.
Yeah.
But these were the ones who would ask the nurse to call for us very often, the medical side, so we would kind of get used to some of these patients. But you have to be discerning, but at the same time, you can't tell. You have to investigate everything. It's like little boy who cried wolf, right?
Yeah.
I can't the one time say, yeah, you're lying, and then it's real,
Right. And I just think in general, a lot of healthcare professionals, we don't necessarily want to be confrontational. It's a little bit different in psychology where sometimes it helps further the therapeutic process if you're a little confrontational about someone's behavior or what's going on. But in the medical field, I don't think coming in and challenging someone about their symptoms is necessarily something that you would be expected to do on a daily basis, nor do you want to do. You kind of just want to go in, help treat someone, make them feel better, and send them on their way. You don't want to start...
You want to develop trust.
She said. Exactly, about trust.
Right.
And so diagnosis can be very, very difficult. One thing, like I said, just it going undetected for so long can be very difficult. So some of the things that people, in cases that we know have been caught and have been admitted to, and honestly, a lot of these cases people don't admit to, even when they're serving time, they're not admitting to this being an issue. Typically, when people are admitting it, it's when it's Munchausen by proxy, because they're now saying, okay, when you're separated from this person's perfectly healthy. So explain that. And then people tend to admit a little bit more. But typically the ways to quote unquote diagnose would be contradictory or inconsistent symptoms or lab test results, no clear reason why they're not improving, even with the right treatment, illness not following the typical course, no believable reason for illnesses or injury, the medical history doesn't make sense, or you're actually catching them in a lie or catching them harming themselves, tampering with things. And that's usually the easiest way to diagnose it is like, look, we have actual proof right here that you're doing this. And then the treatment is also very difficult because, like I said, a lot of people are not necessarily going to admit that it's something that they're struggling with because it is a struggle. If you think about this, that the time and the energy and the work that people are putting into this, they don't have, maybe it's to fill a hole in their life. Maybe they don't have something else to spend their time with, or maybe they've become so invested and so desperate for this attention that this is where they go, or so desperate for this money. You know, maybe they're just in a really difficult financial situation. They can think of no way out. So these people are definitely suffering on one end or the other. It's just kind of defining what that actually means beneath all of this other fictitious stuff.
Yeah, I mean, it sounds like it becomes all consuming, right?
Yes.
It becomes like your whole life at a certain point, and then it's kind of like a vicious cycle. Like once you've kind of started, you probably just can't stop.
Yeah,
right.
Absolutely. Absolutely. And then I think that's a big part of it when it's the Munchausen by proxy, because if for some reason you do decide you want to stop or you're feeling bad, now it's in the history and now you have to cover that up. So now it's like a whole nother type of deception that you have to do to keep yourself safe, even if you're trying to do the right thing. So treatment, like I said, was very difficult. Definitely from a therapeutic standpoint, from a psychological standpoint, you want to be as non-judgmental as possible, which can be really difficult with people. With certain people, I think you have to have the right personality. I'm definitely the type of person who tries to be really mindful about judgments when I'm working with folks. I worked with folks who, I used to work in more of the forensic field. So that's another field where you need to really approach without judgment. If you're working with someone like a sex offender or someone who has done something, really heinous, you need to be able to approach them for who they are and where they're at versus what they've done. And that can be really difficult for a lot of people to separate out. So knowing like yourself as a provider, can I do this? Or even as like a friend or family member, can I separate this out? If I can't, well, then maybe I need to take a step back for my own well-being, for their well-being, so they can get the help that they need. But some of the treatment options are having one singular primary healthcare professional versus bouncing around from doctor to doctor to doctor. This is going to reduce the amount of visits. It's going to keep the medical history consistent and help manage care that's actually needed versus care that is unnecessary. So kind of staying consistently with the treatment team. And this is more of when it's factitious disorder with yourself. But obviously, if it's by proxy, having that individual have a set team of healthcare professionals who can kind of talk with each other and make sure everything stays consistent. Talk therapy or psychotherapy can help build coping skills, manage stress. Family therapy can be really helpful if it's a by proxy situation so that you actually kind of get everything out there and confront the issues and work through it. A lot of depression, anxiety, things like that can come up as well. So making sure you're getting the appropriate treatment, both medical through medications or talk therapy for that. And then if factitious disorders are severe enough, an inpatient mental hospital stay may be necessary just for the safety of yourself and others, and then to really begin an appropriate treatment plan. Because I think that's the thing that people take for granted when we're talking about medical treatment is it's constantly ongoing. It's not a start and stop. It's like, especially in situations like this, you need to know the history. So you're always going back and you're always moving forward. And so it's this more of a fluid back and forth of treatment versus I broke my arm, I went to the hospital, I had it fixed, that's it. Well, if you break your arm 7 times, then people are going to start saying, okay, well, do you have a calcium deficiency? Is there something going on? Is there abuse? So it's building upon versus being a one static visit to a medical professional. And then apparently the Mayo Clinic gives us some lifestyle and home remedies.
Okay.
Basically, it's having a medical gatekeeper, which I really like that. It's assigning someone that you trust to help you determine whether or not you need to go to a doctor, when you need to go to a doctor, and going with you to fill in any of the blanks or to keep you accountable for that. So I really actually like that idea. I don't know if necessarily folks who are in this situation have enough social supports for that, because I'm sure they've burned a lot of bridges once this is identified. A lot of people may not trust them anymore or might not want to get involved. But I feel like having that medical gatekeeper is great because people need medical treatment over time. You're going to get a cold, or you're going to break a bone or have an injury. You're going to have issues as you age. So it's not like you can just avoid the medical system. That's not realistic. Also, just being reminding yourself of the risks. Don't running. Resist the urge to find new medical doctors, or to go to a different town, or to go to someone else. Just talking with the people that you have connected with, that you do trust, when you're having those urges, to manage these problems, because it is a problem in the long run. Even if you're harming yourself, I think that's almost more of a problem, because if it's by proxy and then it's identified, someone else can keep that person safe, but it's how are you keeping yourself safe? So kind of thinking those things about those things when you're considering what you do in the long run with people who are somehow identified and admit to having factitious disorder. And then keeping a log of your medical history, something on paper. So it doesn't even need to be a discussion. You just hand it over to someone, your medical care professional. They look at it. They ask you questions, instead of you having that inclination to start filling in the blanks or exaggerating or lying if you've been doing it for so long. Some of the stuff you may actually forget what the real answer is. And so you're like, well, I've been telling people this. Yeah.
Right.
Yeah. So it can get really confusing. And then there's a wonderful, I'm not going to go into it, it'll be in our links in our show notes, lots of specific questions that healthcare professionals can be asking someone that you're suspecting of factitious disorder without saying, are you lying? Like saying, are there other possible causes? What diagnoses have you had? What diagnoses have you not had, but you're suspected? Kind of just being more in tune with how cloudy and muddy medical care can be at times, and just really being honest with someone and being non-judgmental. I think that's the big thing.
Yeah.
Is to take the judgment out of it, take the anger or the resentment out of it. Because I think a lot of medical professionals can feel burned when they find out their patient has lied to them for a long time, especially if it's someone that you've trusted. So just being really mindful of how you're asking questions, why you're asking questions, if it's necessary or not, and then the information you're getting and what adds up to. And then another case that's been really popular in the media, I'm sure people who are listening are like, why aren't you talking about Belle Gibson? Well, guess what? Someone's going to talk about her right now.
Quick question, though. Did ages that it comes on? Is this like a teens, 20s, 30s?
So there's nothing specific, because it is so hard to diagnose and we don't have, these longitudinal studies. But I think a lot of the trends we've seen have been women, unfortunately.
That was my other question. Yep.
Yeah. A lot of women, a lot of mothers within the by proxy situation. We're seeing more mothers inflicting it on their children. Once in a while, you hear about a wife and a husband, or
I could see that too,
or a daughter and their older parent. But typically it's with children. And if you think about it, children are more vulnerable. They're going to trust their parent. They're going to go along with what their parent says. So it just makes it a little bit easier.
Of course. And
the unusual thing that we have determined is that in families of multiple children, it tends to be just one child that is focused on.
Yeah, I do have patients who they were a victim of this, and
their siblings were not. Yeah.
Right. Only the one.
Which is also just in child abuse in general, it does tend to be focused on one child in a household, unfortunately. Really? Wow. And then as far as ages, like I said, a lot of these folks have experienced this themselves as children. And so it's kind of hard to identify exactly when it starts, but we start seeing more explicit factitious disorder symptoms, usually in late teens to early 20s. But it can go as late until, I think Dee Dee Blanchard was in her 60s, I believe, when she died, and she was still actively doing things to harm Gypsy Rose. So it is kind of something that once it starts, it's very hard to stop it.
Right. Okay. So yes, my cocktail is called Apple Cider Vinegar, ACV.
Wow. Yeah.
So it's 1 ounce of bourbon, 1 ounce of apple cider vinegar, 1 ounce of maple syrup, and 2 ounces of ginger beer. And basically you fill a rocks glass with ice, you add all of the ingredients, and you stir it, because especially the maple syrup will fall right to the bottom. And it's actually pretty good. That's first,
the only way I would drink apple cider vinegar is mixed with that, because I've tried it. Like, I know it was like a whole health craze, and it was
we'll get into that. But yeah, it's a little heavy in the apple cider vinegar. And at first, before I stirred it, I was like, ooh. But then once I got the maple syrup kind of stirred in, it was pretty good.
I'm excited about this, because just for our listeners to know, it was my idea to talk about apple cider vinegar. And then I went off on my own tangent for Scamanda, but I watched the whole thing twice and was just riveted. And then I watched the documentary and YouTube stuff.
Right. So I did the same. The show Apple Cider Vinegar was the dramatization. And then there was also a 2-part documentary series called The Search for Instagram's Worst Con Artist 2023. And that was on Netflix. And then there's actually, because that takes from a 60 Minutes Australia interview, that Netflix one. So I actually watched the full 60 Minutes interview as well, which is found on YouTube. And it's called Unmasking Belle Gibson, the real story of the infamous wellness scammer. And that's from 60 Minutes Australia. So I tried to get as much as we could as far as different views of what's going on. Although I do think the dramatization did a good job. There are definitely some fictitious parts. They have a secondary character who they kind of created as an amalgam of a bunch of different characters, obviously for simplicity and drama. So April Cider Vinegar is a 2025 Australian television drama limited series, and it was on Netflix. And basically it follows the story of Belle Gibson, who was an Australian influencer, wellness influencer, and she claimed to have terminal brain cancer, but that she overcame it with alternative medicine. So the way the show, the dramatization, because that's kind of where I'll follow the timeline from, is it jumps around the timeline. It shows later when she's trying to now salvage her reputation, and she's working basically with this PR guy to help figure things out. And it goes back of sort of the retelling of her story. So it follows her. It follows another character called Mila, who in the dramatization has bone cancer, but does not pursue treatment because she wants to follow a more natural approach. And she uses this black salve and things like that, and diet and juicing in order to help avoid having surgery to remove her arm, which would have removed the cancer. So it follows, basically Belle. Most of this happened after she gave birth to her son. She's struggling financially, starts an affair with this IT technician, Clive. So this is not the father of her child, but is her boyfriend. And he's very, very supportive. Clive, at least in the dramatization, poor guy.
He's the hero of the story. Like, you feel so bad for him.
He takes care of the kid. He does everything. But essentially, in the show, let me catch up where I am. So in the show, Mila, this other character, goes to this Hirsch Institute, a Mexican hospital, and Belle attends the launch of Mila's book, telling her story. And sort of in the dramatization becomes a little bit of a competition. In real life, that's not how things happen. But essentially, Belle gets this idea that she wants to form this app for an eating plan in order to cure cancer. And so she starts telling people that she has brain cancer. And, what's interesting, it's not quite the same. I wouldn't say that what she has is Munchausen, because she really doesn't seek medical treatment. She goes for like one MRI. They're like, yeah, you don't have brain cancer. Your mother has MS. You don't have that either. And then everything else is really just her word.
So that can be Munchausen, but she's not seeking the medical attention. She's seeking the social attention.
Right. Okay. So there. Yeah, they didn't really use the word Munchausen with her, which I was surprised, even with the interviews. So even there was one point where they have like the boyfriend dropping her off for chemo or a test, and then she like walks out the back door and never really actually goes in. So it's interesting. It's just a slightly different way that this happens. But essentially, basically, she makes this app called The Whole Pantry, which is supposed to be healthy recipes. And it's a cookbook that she's trying to get published and all these things she's trying to do. And she grows this brand. I mean, she really does. She's all over the news, this wellness, whatever young person who's going to change the world kind of a thing. She definitely uses her charm and her way with people to move herself up in the world. And, the sad part is that these wellness people sort of influencing people to not seek true actual treatment for their cancers. And that's the biggest thing in this whole story, is that a lot of people, because she says, I cured my brain cancer with diet, are then foregoing actual medical treatments. And that's where the real damage is done. So, but what's interesting is there's another person who she becomes friends with, who's actually this Mila's friend, who's a writer. And the way that Belle eventually gets caught is because she states that she's going to put this percentage of her earnings and give it to these charities. And that's where they find her out. And that's where the story comes from, because they track down that she never gave that money to those charities. So it's a little different in that she wasn't asking for a donation. She was earning money through this app and through whatever else she was doing, but it's because she she promised on her website and she promised these charities and all these things, and then she didn't do it. And that's where they really tracked her down.
And the shame is like, I had like looked up what the real app looked like, what the real book looked like, and it was like nice. Like it would have been a really great business if there wasn't this lie behind all of it.
Right. If you didn't have to say you had cancer, you just have to say I have a healthy lifestyle, and this is really a nice way for people to be able to put together great meals and live healthy. I mean, there's nothing wrong with that part of things. There's even a part where things come to a culmination, and that happens in real life and in the story, where it's her child's birthday party, and she feels that people are starting to catch on to her, and she goes and has that seizure and then doesn't want to go to the hospital, of course.
And like from viewing that, I know that was just a dramatization, but like for people who have never really seen a seizure, the actual act of it was fine, but she was out of it and up and around and perfectly clear like way too quickly. Like someone would have had a little bit of disorientation or a little bit of tiredness, fatigue, confusion.
Right. There's something called a post-ictal period.
Your post-ictal period. And that can last from, I believe the time frame is 3 minutes to like 2 hours. It can last a significant amount of time.
Yes.
So like that. And when I told you I had witnessed a fake seizure, it was very much the same, where this person was totally fine. Then all of a sudden they froze, they dropped to the ground, they're convulsing. And then because we had some ideas that these were not real seizures, we actually continued to have, like, we got down on the floor with the person and made sure they were safe, but it was the person and their parent and myself. And so the parent and myself started having a conversation about something totally different, basically about how like the child had gotten a new puppy and like, well, you know, this is a hard session. When she gets home, she's going to play with the puppy and she'll feel so much better. And she literally stopped mid convulsion, opened her eyes, sat up, and started telling me all about this puppy.
Oh, wow.
And I was like, that is not a post-ictal phase.
Nope. And
in the midst of a seizure, you technically may not even hear what's going on around you. So some confusion about that.
Yeah. I mean, basically everything just falls apart around her, and the book deal and everything else sort of falls apart. Her personal life falls apart. And, you know, the whole, like I said, dramatization story, this other side character, Mila, never seeks her treatment. Then her own mother gets colon cancer, and she at first doesn't seek treatment. The mother dies. Mila's putting black salve in her arm. Eventually they show that that's eaten through her arm anyway, and she still needs it removed because she still has cancer, and she ends up dying too. So that's kind of the moral in this whole thing is the influence and the unfortunate deaths of other people that came from this blatant lying. And I'm sure this goes back to, like you said, childhood trauma, some sort of personality disorder, something that she had that compelled her that I need people to love me.
Well, and she alludes to her mother faking MS. So like that could have been something that she either learned from her mother, or like there's definitely allusions to her childhood not being the best.
Exactly. So it's interesting. The dramatization was a good watch, but the interviews, the real documentary interviews, they pushed her, and
she didn't crack. Yeah.
She couldn't come out and say it. Like, she couldn't come out and say it. It was interesting. Like, at this point, it's blown up. Be like, yeah.
Well, I also think it's like part of that where we've all done this, where maybe we've told a little white lie and then we've told it so many times that now we don't even think about it when we say it.
Right. But the word is, do you have brain cancer? Well, do you have brain cancer?
Yeah, and I think there's a part where she's like, well, I believed that I had brain cancer.
Yes.
Like, that's not the question.
But that's not the same. Yeah. Right. Do you have a scan confirming brain cancer? It's very interesting. And the way they tie in the title, Apple Cider Vinegar, is essentially, it's very well known to be a cure-all. And one of my favorite podcasts likes to say, cure-alls cure nothing.
Yeah.
And that's kind of the truth, you know, so there's nothing that's one miracle cure for everything. And so this kind of in the dramatization goes back to some time where she told people that she had some sort of parasite and she got rid of it by using apple cider vinegar.
Yes.
And so that's at the very end, it was kind of odd how they sort of did that whole thing, like the whole flashbacks of that. And
it reminded me a little of, if you've seen the movie, not the TV show, the movie Catfish, how they tie in, how they come to the title. It's very like offshoot random, but it like does pull it all together. And then you're like, okay.
Yeah. Yeah. So, you know, in the end, this is in Australia, obviously a different legal system, but there was legal action against her, and she has a fine of $410,000. And as of March 2025, she has not paid that fine.
Well, where's
So
she going to get it from? Because her main business was all this health
everything's
stuff
gone.
that she can't do anymore.
Everything's gone. So it really did all blow up in her face. So, it's interesting, this wellness scam essentially is what she did. And let me get down to the rest of my notes here. So, first I'm going to go real quick through what apple cider vinegar, right? So my drink is apple cider vinegar. Internet claims, again, that it cures everything, but let's see, what can it do and what can't it do, right? So vinegar, we know, different forms, basically is made from yeast converting the apple sugar into alcohol, and certain bacteria then turns the alcohol into acetic acid via fermentation. I don't know if you've ever seen like real vinegar. They end up with this thing called the mother, which looks like an alien blob in the middle.
Yeah.
Which is kind of freaky, but it's strands of yeast and bacteria all stuck together. There are some potential probiotic effects that are sort of being studied. And actually, apparently, whatever I had in my cabinet was raw apple cider vinegar, which I don't know why I had that in particular. Maybe it's all they had in the store.
Probably for a recipe or something.
So it's a little cloudier and a little bit more potent too than regular. The nutritional content, though, is similar to apple juice. It does have a lot of B vitamins and polyphenols. So some of the claims that it can control blood sugar. A 2004 study, it lowered post-meal blood glucose levels. They're saying it can be added to your diabetes regimen. It is not to be used on its own, but it could be a complementary use. I don't think it's going to drop your sugar significantly, but if a few points here or there and you can tolerate it and you don't have any contraindications to it, have at it. Antimicrobial properties. There was a study, which is interesting because all the time there's always like lettuce is contaminated with salmonella or listeria. So there was a 2005 study that apple cider vinegar and lemon juice reduced salmonella on contaminated greens. So have the vinegar in your salad. I mean, a lot of dressings are vinaigrette based anyway, but a little heavier on the vinegar end of the vinaigrette and might kill some bacteria.
Okay.
And avoid,
I still don't want to risk getting salmonella or listeria.
No, but this happens all the time. Weight loss support, they're saying 2 tablespoons of apple cider vinegar daily and a calorie deficit led to more weight loss. 8.8 pounds versus 5 pounds in a 12-week study.
Maybe it's because it tastes so gross you don't want to eat.
Maybe, but it says it's a possible appetite suppression, but it still requires diet and exercise. So again, not a cure-all. Hey, if you want to add it to something, sure, but it's not a cure-all. Other myths that it can control your blood pressure. There's no evidence of that. And then cancer. So some lab studies have shown anti-cancer effects on isolated cells, but not in real world humans. Mm-hmm. So vinegar consumption is linked to lower esophageal cancer rates, but that's with rice vinegar, not apple cider vinegar. And that was, I think, in a Japanese population. Smoking and alcohol are very big risk factors for all kinds of cancer. Stopping those would help. Now, I thought in my outline I had this, but a lot of people, which this always really befuddles me, say that it helps them with acid reflux. Vinegar is an acid. It is acetic acid.
Right.
We tell all our patients with acid reflux to lower the amount of acid. No orange juice, no tomato sauce, no coffee, no chocolate. I tell people this every single day. I don't know how, in any way, shape, or form, this could make you have less reflux if you're adding acid to the acid that's in your stomach. I don't know. It's not even mentioned because I don't think there are any studies at all.
I'm just trying to think of the reasoning. And I know with certain people who have ADHD, adding caffeine almost has a counter effect and reduce it, but this is not the same thing.
No, in my little outline, it does say here under limitations that it can erode your tooth enamel. It says here worsening of acid reflux, but I have so many patients trying to come to me saying it fixes it. Potentially could be a harmful to patients with chronic kidney disease, and it is a supplement, not replacement for a healthy lifestyle.
Yeah.
So
it just doesn't taste good. So why are people chugging this stuff? I could see if it tasted good, you're oh, it's not going to hurt. Let me add it.
I don't know. I think people think when something tastes not good that it's better.
That it's medicine? No, it's not medicine.
So, the biggest thing that Belle specifically was cancer and diet, right? Mm-hmm. So I'm going to tell you from the top, diet cannot cure cancer. Certain things in our diet are shown to prevent cancer or reduce the risk. Mm-hmm. There is no black and white prevention. So this one article that I had read essentially took an amalgam of all of the anti-cancer diets that have had actual studies done and kind of came up with these are the things you can do in order to reduce your risk a certain amount.
Now,
We
and
don't know what
question,
percentage.
is this reducing the risk of worsening once you've been diagnosed, or
No.
reducing the risk when you're cancer-free?
Reducing the risk of getting a cancer.
Because that was what confused me about this show. It's like this was basically targeted to people who already had cancer.
Right.
So it's like none of this
right.
is going to make that change.
Of course, being healthy and having a healthy diet is going to be complementary to your health in general.
And to your
And
treatment.
while you're going through treatment, that's great and that's
Right.
helpful. But there is absolutely zero science that will help cure your cancer. That's in prevention. You know, they say that lifestyle and diet contribute about to 30 to 40% of cancers. So big risk factors are obesity, nutrient poor foods like sugars and refined flours, diabetes and impaired glucose metabolism. Low fiber diets are definitely a problem. High red meat consumption has absolutely been shown to be a high risk factor. An imbalance of your omega-3 to your omega-6 fatty acids.
Well,
so,
and on the mental health side of things, I think the story of Mila in Apple Cider Vinegar, a lot of it is not just physical wellness, it's mental health wellness. She was learning not to let the diagnosis depress her. She was trying not to be so anxious. So, and there have been studies that have shown that better mental health has improved response to cancer treatments and, you know, elongated life. So it's like the stuff that at least Mila was doing wasn't going to stop her cancer, but it was going to make her adjustment and her longevity with cancer longer if she had followed that along
and pursued
with
treatment.
appropriate cancer treatment.
Absolutely. I mean, it makes sense that, you know, I think it was trying to take control in some aspects too, take control of a situation that feels out of control.
Yeah.
But, you know, other foods that have some evidence to lower cancer risk, flaxseed, increased fruits and vegetables, apparently garlic and onion.
I've heard of garlic before. I haven't heard garlic and onion.
And then cruciferous vegetables like broccoli and things like that are going to make you nice and gassy and bloated.
I was just thinking of that Big Bang Theory episode when Sheldon decides to increase his cruciferous vegetables and then he's having gas the whole episode and causing problems. Yes.
Other nutrients that are helpful: selenium, folic acid, B12, vitamin D, chlorophyll. I'm not sure on that. And then
just in plants.
Yeah, I have actually heard of people though taking, this is a side note, but chlorophyll drops to reduce body odor, and people swear by it.
I mean, it's making the oxygen flow in and out of your body. So
I don't know. We're not plants, but hey, I mean,
I was going to say, am I thinking of the right thing in plants?
In plants, yeah. Okay. I don't know why. But anyway, it's not harmful. So you do have to be careful. Like, so folic acid and vitamin B12 are water-soluble vitamins. You're not going to overdose on them. You can overdo vitamin D, so you have to be careful with that. I mean, most people are vitamin D deficient, but occasionally I'll see someone who's taking too much. And then antioxidants. So alpha-carotene, beta-carotene, lycopene, lutein. You know, helpful. Again, healthy diet in general, yes, it reduces your risk of all kinds of things. Mentioning here, and again, I'm not going to tell you to go do this, intravenous vitamin C is a potential benefit. Do not go and pay $100 for some IV lab to give you IV vitamin C. Just eat a healthy diet. Oral digestive enzymes, I'm not sure why that would be helpful. We use that for people whose pancreases aren't working correctly. And probiotics, which eating foods like, sounds funny, sauerkraut is actually that fermentation and those natural probiotics and things like yogurt and things like that are helpful for our gut and our gut microbiome. So maybe there's a connection there.
Yeah.
And they're estimating based on an amalgam of all these studies. This is not hard science here. They took, like I said, a bunch of things and put it together, and they're saying that you could, if you had a perfect anti-cancer diet and did all of those things I said, that you could have a 60% decrease in breast, colorectal, and prostate cancers and 50% decrease in lung cancer. Again, this itself isn't a study. They're estimating this based on an amalgam, so I wouldn't say that that's the truth. But yes, eat healthy. Absolutely, eat healthy.
And for those who are watching on YouTube, I was making a face because as Tara was talking, I got an alert on my phone that we posted on TikTok, and I'm like, I didn't post on TikTok.
I did. That's every time I just take. No, every Saturday I take I put the recipes up and then we get flagged because of the song, and I have to go get the one without the song. But anyway, so the perfect anti-cancer diet, adequately but not excessive calories, 10 servings a day of vegetables, including cruciferous and allium, which is the garlic and onion, and vegetable juice, 4 servings a day of fruit, High fiber intake, no refined sugar or refined flour, none. Low fat but adequate essential fatty acids, no red meat. Balanced omega-3 and omega-6, including DHA, flaxseed.
What is omega-6 in? I know omega-3 is in like a lot of fishes.
So I believe, and I'm not 100% on this, but this is why everyone gets angry about seed oils, because they have more omega-6 than omega-3, and you want more omega-3 than omega-6. But again, everything in moderation.
Okay.
Seed oils aren't going to hurt you either.
So if you're making, let's say, salmon, which we know has high omega-3,
right,
and you're cooking it in olive oil, sunflower oil.
Sunflower, right.
Then you should be fine.
Yeah, if there's probably an exact ratio, but again, unless you're making an extreme effort, you're like, yes, don't drink seed oil. If you're using it to cook, you're fine.
Now I can't think of any other seed oils. Oh, sesame oil.
I think canola is considered one as well, isn't it? I don't know. People get excited about these things. I don't. That's why I don't even look it up.
Yeah, like I like avocado oil, but it's hard to find.
It's very
good. I like olive oil.
Avocado oil, you can get the giant spray can one, because I use that for like spraying things from Costco. 2 giant things for really cheap, and that's what I use for like anything I'm putting in the oven.
Well, I do need to go shopping, so
Costco.
The stuff at Kirkland.
All right,
we get a partnership. We've shouted out Costco like 4 times.
I know. All right, real quick. What is a brain tumor?
What is it? It's a tumor. It is a growth of invasive cells in a cluster in any area, but specific to the brain.
Correct.
I didn't even look that up. I just made that
a growth of cells in or near the brain. All right. So primary versus secondary. So primary is something that begins in the brain. Secondary is something that a cancer started somewhere else and metastasized to the brain. You can have non-cancerous or benign tumors, and you can have, of course, cancerous tumors. Non-cancerous tend to grow slow. Malignant tend to grow fast. They can really vary in size. The bigger they are, the more symptoms you're going to have.
And then where they're located depends on whether they can be surgically removed or not.
Exactly. So, a lot of that depends on type, size, and location. Common treatments are surgery and radiation. So, real quick types, gliomas arise from glial cells, which are like astrocytoma. Glioblastoma is the most common malignant brain tumor. Oligodendroglioma and epidemoma. Don't know about that one. Choroid plexus tumors, they go in the cells that produce your cerebral spinal fluid. They're usually found in the ventricles, which are the areas that the fluid flows through.
And I would imagine just by knowing how the brain works, those are probably the most difficult to treat.
Well, because of the location, but also probably don't, until they block flow, might not
be identified. Yeah.
Right, because the brain, I think it was we talked about, is very confined in its space. Your skull isn't stretchy, right? So you have a tumor in your belly. You have a lot of places for that to grow, right? Your head, it's going to produce symptoms because of a mass effect. It is pushing. Embryonal tumors, which come from leftover fetal cells, and the most common of that is medulloblastoma. So most people have heard of that one. Germ cell tumors come from reproductive cells and are mostly benign. Pineal tumors, which are the pineal gland, can be either benign or malignant.
And those can cause a lot of problems. Because I've met a lot of people who have had those.
Pineal, yeah. I don't know that I've ever seen a patient with one, but I'm sure if you've met them, then they certainly have some sort of a symptom.
Injury, so.
Right.
I was already seeing those folks.
True. So meningiomas, which are usually related to... begin in the membranes, meninges of the brain and spinal cord, and then things like an acoustic neuroma, which is a nerve tumor.
So pineal tumors, those are I was thinking like when I've seen people with them, they've had a lot of symptoms. It's all of those like vague symptoms like headache, nausea, vomiting, like eye problems, where it's like, what is causing this? Where then it's determined that that's what's causing it.
Right. Now, pituitary tumors, I've diagnosed quite a few of those. So pituitary, you can have microadenomas or macroadenomas. Typically, they're going to cause things like an elevated prolactin level, and often your hormones, either your thyroid or some of your other levels will be off. I actually recently, this is actually an interesting one, I think I mentioned this to you, that I had a patient who has acromegaly, who was never diagnosed. So acromegaly is not gigantism, but it is growth hormone increase. It would be later in life, so you wouldn't have that linear like height growth.
So the opposite, is it macro? What is the
So
opposite?
macro is a big and micro is tiny. Most of them they don't do surgery on unless they are pushing on your your optic chiasm, and it's impeding your vision.
No, I
So
was
micro,
wondering what is when, like, so you said acromegaly is when somebody has like the too
right?
much growth hormone. What is it
Oh,
when they
just
don't
growth
have enough?
hormone deficiency,
Okay.
just deficiency. And that would be in a child who's not growing linearly. But we see these a lot. Like, and often patients with the pituitary adenomas, you put them on a medication that suppresses it and that's it. Although I do have another patient who just recently had surgery because hers was literally her visual field loss because it was pushing on her optic chiasm, which is where your optic nerves come in the back and cross. They're benign. It's just they can either cause endocrine issues or just physical, like that, pushing on other structures. And then the last thing I'm going to touch on really quickly is black salve, because in the dramatization, it becomes a very big thing.
Yes, I wanted to know more about that, especially when like the lady in the shop like says to her, like, you shouldn't be using, I'm not supposed to sell this to you, but I'm like, okay, that's a red flag.
So it's a topical product falsely marketed to treat cancer, boils, moles, and skin tags. No salve, including black salve, is FDA approved to treat or cure any skin condition. Why is it dangerous? Because it often contains very corrosive ingredients. I don't even know what some of these things are. Sanguinarine, which comes from bloodroot, and zinc chloride.
In French, sanguine means
blood. Yes, sanguinarine comes from bloodroot. Well, bloodroot, or whatever that plant is. So the problem is it harms all tissue. It doesn't discriminate. So you could put on a mole, and great, it's going to destroy the mole, but it's also going to destroy all the tissue around it. It causes permanent disfigurement, tissue necrosis, which is cell death, serious infections, and then a delay in cancer diagnosis and treatment, and then progression while you're not actually looking for real treatment.
Right. And I'm glad that you said that, because when they show Mila's arm at one point, I thought it was just the cancer was
that's the salve.
So bad.
No, her cancer was in her bone, and that could have been taken care of.
I just assumed that the cancer had now grown out of the bone and was
killing
all the tissue.
It could, but no, that was the black salve in the movie or the show. So yeah, it chemically destroys your tissue through oxidation, causes a lot of inflammation. And it has these misleading claims that it draws out cancer but leaves healthy tissue, and that's false. Surface skin can be very damaged, but the cancer can still be growing. And then just a little how to recognize a dangerous salve. Go for any products that are called black salve, drawing salve, red salve, cansema, bloodroot, Indian herb, hawk, dock, natural salve, or black drawing ointment. And then avoid the ingredients, like we said, that sanguinarine, bloodroot, zinc chloride. And red flags are anything that claims to cure cancer, remove moles or warts, or treat skin conditions. And any instructions that warn of burning pain or scarring, or an expectation of a thick, dry scab.
Yeah, and just so if anyone hasn't seen the show, she is getting it from like this woman who basically is like all natural medicine, making it herself. She wasn't like going to CVS and buying it. So
no,
I would hope that this isn't something that you can just get readily available, although I'm sure online there's probably websites you could order it from. Yeah,
the internet.
So we're telling you not to, but I'm just saying it is something that you could probably come across.
Yeah. And the FDA does somewhat track, adverse cases, but not everyone's going to go up and be like, yes, I had an adverse reaction to this thing that,
Especially if they know it's illegal or inappropriate.
But an example that they cited was a patient who was trying to treat melanoma on their face, and basically it ate up their whole nose, like half their nose gone. So, don't do this to yourself. I understand the appeal to nature fallacy in a certain way, right? Because we are all wanting to not do invasive things, but speak to your provider, find a trusted provider, and complementary medicine exists, right?
And I think part of the drive too is a lot of people have this idea that cancers are occurring more often because of these chemicals we're putting in our body or we're exposed to, which I don't think we necessarily have the research that proves that 100%, that's why there's a higher risk. Maybe we just have better medicine and now we can identify cancer better.
It's probably a little of both.
Yeah.
Here's the thing. Do everything else you can to help your body. Eat well, sleep well, drink enough water, don't have too much caffeine, don't have alcohol, don't smoke.
Don't drink the cocktails we talk about every episode.
Don't smoke. Don't, do all these other things. Exercise, get some sunlight, be happy, go out and make a friend, be fulfilled in life. You're going to do better in your health. You know what I mean? Yeah. By doing all of those things. And then just hopefully you can find a provider that you trust, that you can have discussions with, you can answer and ask questions and feel comfortable, but don't have a black and white, just turn away.
Yeah.
Because in the end, and this is what I tell patients all the time, it doesn't hurt me if you don't do this treatment I'm recommending.
Right.
It hurts you. And my job is to care for you and help guide you through this. Like, I don't get anything from prescribing something.
Well, and I think what you're also touching on, they talk about a little bit in the movie with Mila again, and I'm talking more about her just because I feel like her journey felt like it was more visceral. Like
it was more authentic.
Struggle. Yeah.
Right.
But like at one point when her dad finally talks her back into going and getting treatment from her doctor, like the doctor was very frustrated with her and very upset because he saw that now she's dying and he can't help anymore. Right. But I can also see how if she had met that doctor and he wasn't a warm and fuzzy doctor, but he was fine. But I could see if you've had a negative interaction with a doctor in the past and now, God forbid, you have cancer, you may not have that trust in the medical system. And so you may be more likely to turn away from that stuff.
Yeah.
But these other options, we don't have the studies, we don't have the research that say that they're safe. So it's like, okay, if you decide you want to think about it for a little while, that's fine. But trying this other stuff may make you worse.
Right. And like I said, alternative things, like I said, can be complementary. Massage might be a good thing, but again, it's your doctor, depending on if there's lymphatic issues with your type of cancer. Acupuncture, even sham acupuncture has had some proof if it relaxes you. And sham acupuncture, you make it a face.
I was like, are they just sticking needles anywhere they want?
Yeah, so that's how they do the studies. That's what so what they do, they'll do studies, and that's how they compare acupuncture to not acupuncture, is they can just stick needles in random places that aren't on the special lines or whatever.
That's where I was confused.
But if laying in a calm room with probably a candle and it's quiet and whatever, and if that grounds you and you feel healthier when you walk out, it's not hurting anything. So there are ways, and some hospitals even have a complementary medicine or somebody to guide you through that. So you don't have to feel like everything is clinical, or if you want to feel empowered that you're helping yourself to treat your cancer.
Yeah.
So I don't think I understand people are coming from it from a genuine standpoint where they just don't know what to do. They're scared and they want to get better. But people like Belle Gibson, who, scam the whole world, and Scamanda and things like that, they're not coming at it from that intention. So,
right. And especially with Belle, it was always kind of a question in the back of my head as I was watching it. It was like, I don't know if she necessarily understood the full impact of her essentially preying on these other people.
Oh, no. Yeah. I think she was just fame. I'm famous. I feel good. Everybody loves me.
Yeah. I don't think she was these idiots are listening to me. Let me keep doing this. I think she was just like, hey, my app is popular. I'm going to keep doing this.
Right. But she needed that lie to sell it, I guess. I don't know.
It's really unfortunate because, like I said, I looked that stuff up and the photography was beautiful. The recipes sounded good. So it's like the actual things that she was telling people to do weren't necessarily harmful. It was
not at all
everything else behind it that made everyone so sour to it. And it's a shame because she probably could have been very successful.
Yeah. I guess that's what made her stand out. That story's what took her out of the masses of other people trying to be successful.
And as they show in the movie, that story started long before she was successful. So it's not like she just made it up to be successful.
Right. It all started right around the time when she was with her boyfriend and had the baby. And I think she was
remember, it started
even before that.
She was the teenager.
Oh, yes, I forgot. The flashbacks at the end kind of messed me up. And like the story, yes, you're right. She would lie and say, I have this condition. I was in the hospital. She said she had a heart attack. And yes, you're right. I was brought back to life, the whole thing. I do think it was probably some sort of, like I said, a deep-seated need for attention. We've kind of met people like that, in life. And hers, she took times a million and then, scammed people. So listen to us. Don't scam people. That's
Sorry, throwing stuff around. Don't scam us. I'll throw things.
Listen to us. Don't scam people.
Yeah.
End of story. That is the moral of today.
And I think maybe if Belle had been more focused on working through her own trauma and her own issues, maybe it wouldn't have gotten there.
Yeah,
too. So,
absolutely.
Taking care of yourself, like you were saying, whether it's through, complementary medicine, adjunctive medicine, anything like that, but making sure that you're the best person that you could be. That we're all a work in progress. So it's okay if you're not there yet. I'm definitely not there yet.
Free therapy via Nicole.
Look, not everybody. I tell my coworkers, everybody gets one free session a month.
Oh, you know what? Maybe we could do some sort of an episode. Wait, where you do some sort of group talk through. Like, I don't know, something.
I don't know. I don't want to put my license at stake. I'm a little worried about that.
No. How about a meditation? Can you lead a meditation?
Oh, yeah. I could definitely do that.
something, I don't know. I know what you mean. Obviously, that's not medical advice.
Yeah.
Everything we say is not medical advice.
Yes.
But some sort of like, it could be something like ask yourself these questions, like self-work or something.
Yeah.
I don't know.
Yeah.
We'll have
definitely
to
be something.
brainstorm.
Yeah.
We'll have to brainstorm something, fun. All right. So that is the end of our topics. Definitely follow us on our socials, Instagram, YouTube, TikTok, Facebook, Pinterest. Nobody comes to our YouTube channel because it's none. Because I don't put these full videos up yet, although maybe we should start.
Yeah, why not?
We've been just doing our clips and advertising type things and our recipes, but tell a friend to listen to the podcast. That's the most important. Listen on all of those are on Apple, Spotify, Amazon, iHeart, Podbean, something cast. I don't know. We're on a lot of different platforms. And honestly, if you search us, like I've been doing that, Googling, there are other things that pull from different sites. There's like listen notes. There's a couple different ones. So I don't have to be registered on them, but they still pull it from the other one. So if you Google Medical Media Mixer or tell a friend, they will find us.
And speaking of, I told a friend yesterday, I had to go to the liquor store, and Austin of Total Wine and More was a champion and was helping me find stuff. And I gave him our card and he was super excited about it. And then we went out to dinner, and our waiter, whose name I forget, I want to say it was Juan, started with a J, U. And I can't think of any other JU names. So I think it was Juan. I gave him our podcast card, and he got super excited and was showing it to other servers. So hopefully we get some new listeners. And if so, both of you gentlemen were lovely and were super helpful and thankful. So
yay.
Welcome to listening.
Listen to us. Oh, and send Nicole some emails.
Yes,
okay?
Send us an email to medicalmediamixer@gmail.com. I haven't gotten many more listener emails, but we've gotten some emails from other businesses because we're planning some fun stuff for you guys. So that's exciting. So yeah, that's all I've got.
All right. So thank you for listening to Medical Media Mixer.
The perfect cocktail. Cheers.
Cheers.